Hi, this is Dr. Lin from the Dental Department, Kaohsiung Changge Memorial Hospital. Kaohsiung is a harbor city on the west coast, southern part of Taiwan, which is known for its beautiful ocean view. Here, you can enjoy the stunning seaside skyline just within half-hour drive from the center of the city. So, the Kaohsiung branch of Changge Memorial Hospital may be your good option not only because it's high-quality treatment, the state-of-the-art equipment, but also because it's great location. Our dental department has 7 divisions, which are ortho, pedo, perio, oral medicine, oral and maxillofacial, pros, and endo. Interns and residents will be divided into small groups and will rotate to different clinics. I will have the chances to closely work with specialists in different dental subfields. Now, I'll be doing a brief introduction of some of the divisions. First of all, the perio department, led by the chair of our dental department, Dr. Aaron Wu. He has introduced the most up-to-date technique, the all-on-4 rapid full-mouth dental implant. With the all-on-4 system, a full arch denture can be strategically placed on just 4 to 6 dental implants. There are multiple advantages of all-on-4 implant. Patients are often able to avoid bone grafting because the posterior implants are placed at an angle to maximize bone to implant ratio, as shown in the picture on the bottom left. And this is the main reason why the treatment and recovery time can be reduced substantially with all-on-4 implant. Also, the immediate placement of interim dentures can provide patients with a new smile and a fully functioning set of teeth within a week. Since October 2013, the Dental Department of Kaohsiung Changge Memorial Hospital has performed more than 400 cases of all-on-4 dental implant, with the success rate close to 98.5%. In addition to the traditional perio surgery, we also do minimally invasive periodontal regeneration surgery in our dental microscope center. The x-rays on the top show the bony defect prior to surgery, and you can see how beautifully the bone was regenerated on the bottom periapical films. Implant site development is something we do a lot at our perio department, as a lot of patients seek implant evaluation after long-term tooth loss, and their situations are often complicated by severe alveolar ridge resorption. The pictures on the left show the increased width of the residual bone after ridge augmentation surgery. And on the bottom left, you can tell how the procedure had helped with optimizing the following implant placement. Besides guided bone regeneration, we also do a lot of mucogingival surgery. On the right is an example of soft tissue augmentation of a denuded root. Orthodontics refers to the diagnosis and treatment of improper bites and irregularity of teeth and jaws. Our ortho department offers many treatment options based on an individual's needs and desires, including traditional metal wires and braces to invisible braces using clear plastic aligner trays, which is the Invisalign. In addition, we treat quite a bit cleft lip and palate patients. Our ortho doctors participate actively in the overall management of cleft lip and palate patients, starting with the nasal alveolar molding therapy soon after birth, then subsequently in preparation for the alveolar bone grafting surgery, followed by possible early stages of corrective orthodontic treatment, and finally the definitive comprehensive ortho treatment with or without orthognathic surgery. Orthognathic surgery, more commonly known as corrective jaw surgery, is the powerful procedure used to correct the misalignment of the jaws, where the patient's jaws are moved in order for them to function and look better. Our orthodontists work closely with oral and maxillofacial surgeons and plastic surgeons as well. They plan the procedure on the computer, and then the surgeons get 3-dimensional cutting guides and custom-made plates that can be used during surgery. The computer-aided simulation and navigation system allows the surgery to be conducted with high precision. Temporomandibular disorder refers to problems related to pain, inflammation, and improper functioning of temporomandibular joints, muscles, or ligaments. Treatment options for TMD include physiotherapy, drug therapy, occlusal adjustment, surgical intervention, etc. And among those treatments, we offer occlusal splint therapy in our ortho department. Prosthodontics is the treatment and rehabilitation of oral function, comfort, and appearance for patients with missing or defective teeth. Our pros department has three main characteristics: digital dentistry, minimally invasive aesthetic dentistry, and comprehensive full mouth rehab. Digital dentistry refers to the use of digital methods to assist in the diagnosis and accurate treatment planning. Combining 3D facial scanning and intraoral scanning, we can analyze and arrange proper teeth proportion using the digital smile design software. So we are now able to show the patients the expected treatment outcome prior to treatment. For the occlusion, we adapt the digital articulator to redesign the occlusal scheme to satisfy both the function and the aesthetics. In this particular case shown here, we use ceramic veneers, dental implants, all ceramic crowns, and bounded overlay to accomplish all the work. With regard to the anterior teeth aesthetic dentistry, the bounded ceramic veneer is probably the treatment most often performed. Thanks to the digital dentistry, a fast 3D printing prototype of the treatment outcome is presented and confirmed with the patient on the same day, which saves several days to weeks comparing to the traditional backstop procedure. With the use of microscope, teeth preparations can be more accurate and minimally invasive, and the delivery process can be carried out with precision. Full mouth rehab is a very complicated and challenging treatment. Our pros department offers several different types of dental prostheses depending on the patient's oral conditions and their budgets. In the endo department, we try our best to save patients' natural teeth, mainly by doing root canal treatment. Our endo department has 5 dental operating microscopes, including 4 Zeiss Pickle and 1 Leica, and 3 of them are equipped with the documentation accessories. When teeth remain symptomatic after endodontic therapy, or when apical lesions do not heal from conventional root canal treatment and retreatment, apical surgery may be indicated. Endodontic surgery has evolved into endodontic microsurgery over time. By using microscope, state-of-the-art instruments and materials, endodontic microsurgery should be a predictable and viable alternative for saving teeth. As previously mentioned, root canal treatment or retreatment and apical surgery and all can successfully treat more than 90% of the teeth with pulpal and periapical diseases. But in some situations where the apical surgery is not feasible, intentional replantation is brought into play. Here we show a case of upper right second molar with extruded filling material involving the sinus, and intentional replantation was considered the best option for the patient. The tooth was atraumatically removed, followed by an extraoral root end resection, preparation, and retrograde filling, same as what is done during the apical surgery. Lastly, the tooth was put back into its original socket. The picture on the upper right shows complete heal of the apical radiolucency. Autotransplantation is a viable option for treating tooth that is considered unrestorable and needs an extraction. We can see here the bottom left second molar is deemed unrestorable. Luckily, there's a perfect candidate for autotransplantation, the impacted third molar. Although the transplanted third molar seems a little bit short on the x-ray, it's still going strong in the patient's mouth. The field of endodontics has seen vast improvements in technology and techniques over the past several years. Perhaps the one area of endodontics that has improved the most in the recent years is the way in which necrotic immature permanent tooth is managed. These teeth were successfully treated with long-term calcium hydroxide epacification or MTA apical plug epacification. However, neither of the epacification treatments fosters further root development, and immature teeth remain vulnerable to cervical root fractures. The new regenerative endodontic therapy shown here has the potential for continued root development, and therefore may confer a better long-term prognosis. The oral and maxillofacial surgeons treat diseases, injuries, tumors, and deformities of the face and jaws that may require surgery or tooth extraction. While we do a lot of outpatient surgeries at our oral surgery clinics, we also do a lot of surgeries in the OR. For instance, the wide excision of malignant oral tumors and selective or radical neck dissection are performed on patients with oral cancer at the operating rooms under general anesthesia. Sometimes we collaborate with the plastic surgeons for free flap reconstruction if the defect is too extensive. Jawbone loss can cause significant aesthetic changes and oral health issues. To help restore bone that has been lost as a result of tooth loss, periodontal diseases, trauma, surgical removal of benign lesions, or malignant tumors, bone augmentation procedures are often needed. Allografts and xenografts with membranes is the most popular way to do guided bone regeneration. However, for larger defects, block bone graft may be necessary. Iliac crest, mandibular symphysis, and ramus area are the most common donor sites for autogenous block bone grafts. With regard to soft tissue defects of the oral cavity, we often use tongue or buccal flap for reconstruction. For patients with facial bone trauma in the emergency room, we often do open reduction and internal fixation. It allows for direct visualization and reduction of fractured bone segments and restoration of the patient's pre-injury occlusion without complete fixation of the mandible and maxilla. This allows for quicker bony healing to take place, which may help with the patient's earlier normal jaw function, better nutrition, and oral hygiene. Our pedo department offers a large range of services to the young patients. Many services focus on preventive care, including general screenings, topical fluoride application, and cleaning. For the very young uncooperative patients, physically or mentally challenged patients who require special health care needs, or patients with anxiety, we offer the option of treatment under sedation or general anesthesia. Dental sedation is a technique that is used to help reduce anxiety when seeing a dentist. It can be either by taking some medication orally, or it can be by means of inhalation of nitrous oxide, more commonly known as laughing gas. Our pedo clinic offers the IV sedation, which is a deeper level of sedation compared to the two just mentioned. In addition to conscious sedation, we actually do more general anesthesia here. There are usually around 6 children scheduled for full mouth rehab due to rampant caries under GA every week. Same as the sedation, there will be anesthesiologists monitoring the patient's vital signs. During the operation, you'll be able to closely observe how dental treatments are done on primary dentition, including operative procedures, root canal treatment, stainless steel crown placement, and so forth. This is a typical case we treat under general anesthesia. All the works could be done at the same time. We are committed to providing our patients with comprehensive and high-quality dental care. Not only the patients, our interns and residents benefit from a team of experts who practice using leading techniques and technologies in dentistry, and are also dedicated to passing on their clinical experiences and knowledge. Our multi-specialty practicing environment offers trainees the opportunity to learn from all specialists and to comprehend the thinking process when dealing with complex cases that may involve interdisciplinary treatment plans. And of course, during your visit here, there will be seminars, case presentations, literature review, teaching sessions, and so on and so forth. We look forward to seeing all of you in the near future. Welcome and enjoy.